So first of all, I want to thank everyone for coming on this Zoom webinar. The backstory behind this is I tried to do one of these in the office. And I know many of you are patients of Dr. Feldman, Dr. Savia, Dr. Kellner. We all treat the same thing. We all treat plantar fasciitis. I'm kind of the one that likes to send out the newsletter, does the videos, if any of you seen them come out. And I tried to do one of these in our office, but what I didn't realize is our office is very small. I'm in our Westboro office right now, and it has a big pole right in the center of the room. So I tried to do one of these live, and you can only fit about 6 or 7 people. So this way we can fit a lot more people in here. And so it's just more fun that way. And I'm going to answer any questions at the end. Once again, welcome. This is the heel pain workshop. That's what we're going to be talking about, all about heel pain. I'm going to get going here. If you didn't download this, you can download it. I included the link. It's called the Heel Pain Workshop, 3 Simple Steps to Quick and Natural Healing. I'm not going to go into super specific depth. If you've had it for a long time, I'll give you some suggestions and kind of some of the things that set this apart. So let's do some beginning things. So keep your microphone muted. I muted everyone when you came in. Write any answers that I may have in the chat. First of all, let's put what city are you guys from? If you could write in the chat. I know we had some people from other states last time. Are you guys from Worcester, from Shrewsbury, from Belmont? Okay, Elizabeth is from Belmont. I'm from Shrewsbury. There's someone from Leicester. You know, that's the nice thing about doing these via Zoom. You don't have to, everyone doesn't have to come to Westboro or in Millis, okay, West Boylston, Framingham, and we have a physical therapist, Katie's with us, great, Whitensville, Quincy, good. So some distance, it would be half hour, 45 minutes for a lot of you to come here. So write your answers in the chat. I'm going to send you a copy of the presentation afterwards. You can take some notes if you want, but you're going to get a copy and questions at the end. I'm going to give you a free bonus for those that stick around. I'm kind of enticing you, almost bribing you, because at the end, I'm going to give out some special things for those that stick around till the end. Okay. But this is the worksheet that I put together. And I actually got this from of all people. There was a physical therapist, Kelly, that I kind of modeled this after, Dr. Chad Madden. So he had this kind of a neat way of going over heel pain. And this is kind of the one that I'm modeling it after. So we're going to go over some of these, but you don't have to have the paper to go over it. But first I want to go over what exactly is heel pain. So you can see letter A, if you're looking at this, it says heel pain is most commonly caused by the blank or by blank. So I'd like you to write in, why do you think causes, and I'm talking technical things here, like the technical cause, like what's the word for your heel pain? Okay. Does anyone want to write in there what you think? What's the most common cause? And there's a couple of little hints right here. I used a generic word, but there's some technical words here if anyone wants to write them in. Okay, no one's writing, so I'll give you the answer. It's caused, heel pain, here's the heel, is caused by plantar fasciitis. Very good, Sue, good job. And Achilles tendinitis. And the reason I put them together is because a lot of times I'll see a patient 1 year for plantar fasciitis, and then I'll see them a couple of years later for Achilles tendinitis. And back in the day when I started out, I didn't quite understand that. I didn't understand why I was seeing so many people for the similar thing, similar heel pain. And sometimes it can move from one area to other. But the reason, if you can take one thing away, I think it's this letter B here. It says tendons and ligaments. The one you have to know is they have poor what? What do tendons and ligaments? Let me show you. The fascia is kind of like a ligament. And here is the Achilles tendon. Okay, here's an example on the bottom here, bottom right corner of the fascia. Now, no one's written the answer, so I'm gonna wait for someone to write the answer before I tell you. There's a difference between the fascia and a tendon than, for example, muscle. Okay, and I want to know what the main difference. They have poor what? What do they have poor of? I feel like I'm in school here. Okay, if you look at what. There we go. Thank you, April. They have poor circulation. They have poor blood flow. And this, if you can take anything away, is one of the main problems with healing. You never hear of anyone having a muscle-itis, do you? You very rarely, you might hear of a muscle tear, but like a muscle-itis doesn't really happen. you hear a lot of tendinitis. And the reason is because the Achilles tendon and the plantar fascia, they both have very poor blood flow. And you can tell it because if you look on the pictures of these anatomy books, they're white. White things, they don't have good blood flow. White things just, they don't. And so the whole problem is that stuff that doesn't have good blood flow has a hard time healing. Because there's not enough blood flow. And if you could take one thing away is all of our focus, both with physical therapists that are here and with us as podiatrists, is trying to get more blood flow back to that area. And there's a lot of newer treatments that we're using. And there's other things that we kind of use as Band-Aids that don't really get the blood flow back, but they make it feel better. And we're going to go through some of those. So letter C, so 1C, typically people have pain after what? When's the most typical time that people have pain? What do you think? Now I see this probably about all of us 4 doctors in the office with this multiple times a day. And the patients usually say, doctor, I typically have pain when I'm sleeping. Okay, some have pain when sleeping. But what I find mostly, April, is that people have pain, yes, after being sedentary. Yes, morning and sitting, after sleeping. So after sleeping, what happens is you get up, you have to get up. And when you get out of bed, your foot hurts. And so that's usually the most common symptom for plantar fasciitis. I want to give you that as an example. For heel pain on the bottom, it's when you get up. For Achilles tendinitis, it can be getting up, but it can also be when you're going downstairs and you're planting your foot. Let's say this is the right foot and you plant your right foot and then you go down the stairs. That tends to hurt with the Achilles tendon. Also getting out of the car. So if you drive a lot and then you get out of the car, that can hurt. Now the reason for that, okay, the reason for that is when you are sleeping, your foot is limp downward and then everything gets tight. And then when you get up, everything kind of strains and stretches and goes upward. Now, when that happens, it pulls on this area, which is the insertion point of the Achilles tendon, and it pulls on this area, which is the insertion point of the plantar fascia. And that's why it gets inflamed. So this is key. A lot of our focus, and I have a whole couple of videos on a morning routine, and I'll tell you the morning routine. Basically, we recorded this video with Dr. Feldman, and before you get up, you do some deep belly breathing to help stabilize your core, and then you kind of massage the calf, or you do foam rolling on the calf, and then you get out of your bed and you put on some UFOs. Now, if you haven't tried UFOs, I'm not sure, they're not a cure-all for everything, but they're the best one that I found currently, the best sandal. They have a nice cushion to them. They have a nice arch support, and a lot of my patients like them. Okay, so that's how you kind of get out of that out of morning pain or getting out of bed in the morning. Okay, now this condition, a letter C here, this condition is usually caused by. Do you guys know what it's caused by? I know they have poor blood flow. That's not the problem. This is usually caused by tightness. Okay, there can be other things, but I think one of the biggest culprits is tightness, specifically in the back of the leg. Now, one thing you have to realize is my patients, they always tell me, hey, doc, I don't have any pain in my calf. I don't have any pain in the back of my calf. But I always say foot pain usually comes from above. So the problem isn't your foot, it's how your body moves over it. And typically our patients, they have a tight calf. They might have tight other muscles like in the back of the hamstrings, the quads, the IT band, things like that. So this is caused by tightness. It can also be caused by really old shoes, and it can also be caused by what we call overuse, basically just doing a lot. And this is the question that I get from a lot of my patients is they come in and they have all this pain, and I ask them, well, what happened? Well, they said, doc, I'm doing 4,000 steps and I switched to 20,000 steps. I'm trying to lose some weight. Or they tell me, doc, I went to Disney and I was walking around for, 5 miles a day. And so anytime you do a lot more activity, I don't think it's so much the activity, because what you'll find is heel pain doesn't usually happen the first day you do that activity. What usually happens is after the first day, your calf is really, really tight. And then you try to do things the next day without loosening things up. So a lot of our focus is going to be on physical therapy modalities and soft tissue massage. Okay, so that's what we're going to talk about in terms of heel pain. I want to tell you a little bit about who I am. I'm not a YouTube star. Okay. You're going to laugh at me. Before I got into podiatry, a couple of stories. I wanted to get this. Well, who guess? If you're not my patient, you can guess what did I want to do before I became a podiatrist? It involves, I'll give you some tips. It involves doves. It involves kids. It involves, let me think, what other tips I can give you? It involves, there we go. I wanted to be a professional magician. Okay, I can even show you a trick right here. You take the pen, you hold it like this and it doesn't fall off. But anyway, so whenever I get kids in the office, I always get about a half hour behind, and there's tons of like bunched up gauze behind the chair. The staff always knows when I'm seeing kids. So I show them coin tricks. If you want to see a trick, I'll show you when you come into the office. So I wanted to be a professional magician. Well, it's really hard to be a professional magician. So I did that. I wanted to do that till I was about 17. And then when I was 17, I went to Brazil as an exchange student. That's how I ended up in Massachusetts, because there's a big Brazilian population, and I lived there. And I came back, and I ended up meeting my wife because there was a lot of Brazilians here. She was in Brazil and she moved here. So then I came out here for residency at St. Vincent's in UMass, and I kind of gave up on the magic thing, except with my kids and when the patients come in. But I've always liked this thing about public speaking, and I was thinking that I can switch it to be like a motivational speaker. So medicine was my backup gig. It was a pretty good backup gig, but for the fun of it, that's why I do these other things. So this is my YouTube page. I have 13,000 subscribers. So if you want to subscribe, you can watch my videos. Now, I used to do the really gross videos. I don't do those anymore. I used to do the gross ingrown toenails. I don't do those anymore. But as you can see on this YouTube, I have some free books. So that's what I'm going to share with you guys at the end, is how you can get those free books. I have them on plantar fasciitis and stuff. Here's an example, one on plantar fasciitis, one on Achilles tendinitis. I put these together because another passion of mine is then teaching people, okay? And I came to specialize in heel pain because I've been doing this for 15 years, and I've made pretty much, I don't know if I made a lot of mistakes, but like a lot of patients just didn't get better. So we had to learn more and more and more and get better at it. And I never know if they get better or not, frankly, because sometimes patients just don't come back, right? I was actually sent out an email recently, and a patient said, I got a cortisone injection, and she said she had PTSD, post-traumatic stress from her cortisone injection. So I'll talk a little bit about that if you're concerned. So that was a question here. Sue asked, what if you have both conditions? I'll address that at the end, but they're both treated the same way, basically, and we'll get into treating them, okay? But I want to talk about, I have here how treatment is improved. There's two ways treatment's improved. One is ultrasound, and another one is shockwave, and I'll go over that a little bit more towards the end. So I want to first go over here. Both treatments they're treated the same way, basically. The only difference is you should not have a cortisone injection for Achilles tendon. Okay, you can do cortisone for plantar fascia. Okay, but you don't do it for the Achilles because it could cause a rupture. Other than that, all these treatments are synonymous. Okay. And so that question here, should you see a podiatrist regularly? Well, I have 2 children to put through college, so I think you should see me regularly, at least once a year. Most patients don't, except they're diabetics. You can, but it's not like a dentist seeing once a year. Diabetics have to see us once a year, but not everyone has to see us once a year. Certainly if you want to see me, I could show you a magic trick. Anyone that wants to come in, I'll show you a magic, just pay the copay and I'll show you the magic trick. I'm just kidding. So let's go in here. What's the biggest mistake? I want to talk here about the biggest mistake most heel pain sufferers make. The biggest mistake is they do everything on the bottom of this sheet. Okay. Now I made this little thing. I call it the heel pain treatment evaluator. And the reason I did this is there was a lot of confusion with my patients. And everyone thinks that all things are created equal with treatment. And they're not. And so everyone does everything underneath this line, and they think they're going to get better. And what I mean by that, there's a lot of treatments that are most effective, and there's other treatments that are less effective. And so what I find is that people, they wait too long to get treatment. If you have heel pain and you are listening here, write in how many months you've been having pain, even if you're getting treatment. How many months was it before you sought help to get relief from your plantar fasciitis? Or if you haven't gotten help yet, how long have you been suffering? What I find is that first of all, women are a lot smarter than men. Okay, so women tend to come in faster. Okay, I'm going to give that to the women, but I tend to find that most people wait too long. Okay, so Deborah said here 2 months, 9 months before the first visit, 2 months. Okay, 2 months I can see, 2 to 3 months if you're trying some things on your own, if you're Googling it. So I think 2 months, if you're doing these things and it doesn't get better, you should see someone. What are these things? These are the things that they try. They try oral anti-inflammatory. So Motrin, ibuprofen, Tylenol. They try icing and contrast baths. They try topical things like Biofreeze and these other arnica and homeopathic things. They try stretching, over-the-counter arch supports. They try like taping their foot or a compression sleeve, or they try losing weight. So all of these things from the yellow line below are the things that people try to get better on their own. And so I think if you've tried these, if you're trying these, let's say for 4 to 6 weeks and you're trying them and they're not better, you should see someone. That's my opinion. The reason, and this is like anything, this is the same wording I use for a physical therapist. I just think people get better faster when they go to physical therapy. And I think people get better faster when you see a podiatrist. Now, just because we do other things. Now, the other things that we do, I'll go over with you a little bit later, but I want to focus mostly right now on the categories. Okay, so these are the categories. I like to make things really simple for teaching. The category is reducing inflammation and repairing the tissue, reducing tightness and tension, because I think it's a big culprit, and then reducing stress and strain through your foot. Okay, so this is a treatment evaluator, and so you can evaluate. Now, some people I find are jumping into the orange line on their own, and there's one reason that people can jump into the orange line. Any idea? You can type it. It starts with an A. The reason you can jump into the orange line starts with an A. Anyone have an idea why people can jump into the orange line here? These things. Owns half the world. Amazon. Thank you. What I find is that all my patients, they come in, they say, doctor, I've been having pain for 3 months and I bought all these things. I bought an over-the-counter arch support. I got one of these night splints. I got one of these roller balls. I got one of these Theraguns. I've got these 500 pairs of shoes. I've got all these things and I'm still not better. So let me give you a rule of thumb. Okay. If you have spent more than 3 months or more than $300, go see a specialist. Okay. You don't need another shoe. Everyone asks me, doctor, what's the one shoe? The physical therapists get this all the time. What's the one shoe that's going to make my heel pain go away? There isn't one shoe. If there was one shoe, I wouldn't have a job. There's not one shoe. And if your right foot hurts and your left shoe doesn't hurt, then the problem's not the shoe. The problem's your foot. Okay. So don't go spending more money. So that's the biggest mistake. Let's go here and talk about the 3 most common causes. Now I'm going to talk about the causes. And now you'll notice this is just kind of like school. It's repetitive. Okay. I wrote here, the 3 most common causes are, in the letter A is tightness to what? What do you think is tight? Any idea? I already said this. So it's kind of like I gave you the answer. Now you have to get what the answer. Thank you, Alan. Tightness to the calves. Now, a technical term for tightness to the calves is this word right here. You don't have to worry, there's not going to be a test. It's called equinus. So equinus is tightness in your calf where you're putting more pressure to the foot and everything is tighter up in here. So that's one reason, is tightness to the Achilles, which is also called equinus. Letter B is too much impact. We talked about that before. Now, what increases impact? For example, let's say you have an old shoe. Okay, old shoe, no cushion, that increases impact. Let's say you are going to Disney and you're walking for 5 miles. That's increasing impact. Let's say you're starting CrossFit and you're jumping around a lot. That's increasing impact. Let's say you're shoveling. That's increasing impact. So all those things, too much impact, jumping and things like that, can cause heel pain as well. Okay. And then also a poor choice in shoes. Now I can't make shoes a culprit for everything. I really think if you're going to rank the causes, I think the number 1 cause is tightness. And then some of the other causes are like shoes and other things, really depending on your foot. Okay, so a poor shoe choice. Now, I'm going to go over 3 strategies to reduce heel pain, and I'm gonna go to get into some of the questions. Okay, so some of the strategies. Now, I went over. If you look here, I kind of went over all the strategies right here. So here are all the strategies. 3 of them I want to focus on though. So one of them is reducing inflammation with something called shock wave. Okay, this is something that you may have never heard of. Also something like amnio, you may have never heard of, but I know all of you have heard of cortisone. So remember that patient that I said they got post-traumatic stress? We used to do, all I used to have in my tool, I didn't have this as an option when I first started. And all I had was cortisone. So pretty, okay, you're going to like this one. So I told you I was a magician. Don't tell anyone this, okay? So part of magic is you have these hidden pockets. And so my staff forbade me to do this. I had this special jacket and I had this clip with my name on it. And inside I made a fabric almost like a pocket inside. And in this pocket, I used to put injections. So I used to put injections to numb up kids' toes and cortisone injections. And I did it because I didn't want them to see it sticking out of my pocket on the outside. But what I didn't realize is the patient, they never saw it. And sometimes I used to be I could just quick it and put it right. I was the quickest draw in the West. And until my staff, they made me get rid of my hidden pocket for it. But cortisone injection, it doesn't take that long, but it hurts quite a bit. But the other part with the cortisone is I find that it doesn't do a great job at actually healing the fascia. It does a good job at reducing the inflammation, but if the fascia becomes thickened, so what do I mean by thickened? Well, the fascia is usually supposed to be, I don't know, like maybe the thickness of an egg, okay? But then sometimes it can be like the thickness of a pancake, and it gets almost like scarred down and thickened. And because of that, because it gets thicker and thicker, it doesn't bend as much, it gets inflamed a lot easier, and it doesn't calm down. So if there's only inflammation, cortisone can work. But if it's actually become thickened, which we call fasciosis, it doesn't really respond as well. It responds a lot better to shockwave therapy. The same thing with the Achilles tendon. If you ever injured the Achilles, usually it's nice and narrow, but when you injure it, it gets thickened around it. So that thickening of the Achilles tendon as well doesn't bend and move and things like that as much. And that's where the shockwave therapy works really well. So one of the ways to reduce the heel pain is the shockwave. Now I want to be very clear. This shockwave, what is shockwave? Basically, it's 2 pieces of metal hitting against each other, and it shoots sound waves into your tissue. This originally was used to break up kidney stones when people have kidney stones. So they put people in water, and they shot the kidney stones with this sound. And it broke up the kidney stones because the sound waves hit there and broke up the kidney stones. So what we do with the fascia and the Achilles tendon is we hit it. And remember what I said, the Achilles and the heel in general, those tendons, they don't have very good blood flow. So the sole purpose of the shockwave is to injure it so it sends more blood flow to the area. So all the tissue around there gets more blood flow so that can heal on its own. So the way of reducing heel pain, the pain is better. It's reduced better with anti-inflammatories and icing and cortisone, but those don't last that long. The way to last longer is the shockwave therapy. I'm not going to go much into these amnio, but amniotic stem cell, it's kind of like the difference between using a core aerator on your lawn where you cut out plugs and then it helps the lawn heal, to putting on Miracle-Gro. The amnio is like the Miracle-Gro. It helps. We do it for our athletes. So that's one way that we help heel pain. Another thing we do is we stabilize the foot with, and right here, it's with an orthotic, okay? There's a quick question about shockwave. So I always say with shockwave, I do between 3 and 6 treatments. And the way I determine that is if you have pain for over 3 months, you say you need 6. I start out with 3, 6-week break. And then if I need to, I can do another 3. I've only once had to do 3, 6, and then another 3. That was a person that had heel pain where the Achilles tendon inserts into the bone in the back, That's a really hard one to get rid of. She had that for like 6 years, but it goes away with this. It's just amazing, the shockwave. So that I usually do 3. Most people get 3, but some can need up to 6. So the other thing is to stabilize the foot. And this is something else I want to kind of focus on. A lot of times when we're standing and walking, we have a lot of stress and strain going through our foot. There's been a lot of research in terms of the foot. The problem isn't so much, and I don't want to get technical here, it isn't so much like how much you weigh. It's not really how much even impact. It's how much stress goes through your foot. So as you walk, there's a lot of different amounts of stress and strain going through your foot. And there's a way of measuring it where they put these like probes in there. And what they found is that the more stress and strain, the more injury there was to the fascia. And the best thing they found to treat it was an orthotic. Basically, an orthotic contours really high to your arch, and it takes pressure off the fascia and off the heel. Yeah, that's in conjunction with a good shoe and maybe those UFOs. So stabilizing with an orthotic. Now, people always want to try an over-the-counter one first, and I a lot of times have them try an over-the-counter one. My favorite one, there'll be a link to this afterwards. It's called a Walk Hero. It's the best one I found on Amazon. It's $20. Walk Hero, WALKHERO. It's a little bit rigid. It's the best one to start with, and then if that doesn't work, then you can do a custom one. Occasionally, if people have a rupture, they'll need a walking boot, or there's something else called it's called a velocity brace. Basically, it's like a brace that goes up the ankle. I do this specifically for someone that has Achilles tendinitis, and it takes about 30% of the tension going through the Achilles. It takes it off, so it makes people feel better. Because if you think about it, the foot is a little bit different than like if you break your hand or you have a tendinitis in your hand. With a hand, you can just kind of put it in a sling or something like that, or put those little splints on it. People are always walking on their foot. So anything you can do to reduce some of the stress and strain can be helpful. And one of the best ways is there's a certain type of a brace that we do. It's a brace that almost like, it's called an ankle foot orthotic. So it's like an orthotic that goes up the side, and it takes some of the pressure off of it. And then, like I said, also reducing tightness and tension. And I want to show you, there's a couple ways of doing that. But if usually we prescribe physical therapy, but I find a lot of times home therapy, and I'll show you a couple of pictures here. So just one thing, this is just an idea. If you've never heard of it, this can help some people. Now, will it resolve all your heel pain? No. But if you haven't tried it, it's a good idea. It's called a contrast bath. So you put your foot in ice water for 5 minutes, hot water for 5 minutes, and then ice water for 5 minutes. It's almost like restarting your computer. Once again, it increases blood flow to the area. This the same reason why the shockwave does. This is my favorite sandal. These are called the UFOs. And another idea, I got this from Dr. Saviat. He gave me this idea. You can actually stretch while you're in ice water. So if you stretch your foot, you can stretch it when you're in ice water. Reducing tightness. I have a lot of my patients do home therapy. I think if you guys could get one thing, the most versatile thing is one of these foam rollers. Now, just everyone asks me about this planking. They say, oh, I don't have such muscular arms. You don't have to plank. You can just roll it back and forth. I have a lot of good videos on my website, how to do this. I'll send that out afterwards. So this is the most versatile thing. You can use it for the calf. You can use it for your quads, your IT band, your gastroc, your back, your quadriceps, sorry. And you can also use this like stick thing right here. You can use a stick. You can use, these are called trigger point tools. And you can use the orb, which is another, these are all just like deep tissue massage tools. I'm a big believer. Now, what's the purpose of these? Let me explain. I think most of the problem is here on the Achilles and on the fascia, but all these muscles insert into the heel. And if these are tight, it can make your foot hurt. And I've had experiences of certain patients, if I just do like a massaging on if they just get plantar fasciitis or Achilles tendonitis, a very short time, and I do a really deep massage, they have pain walking in, they can be pain-free walking away. Now that's people that haven't had it that long. People that have had it longer, it's not usually that quick. But I'm a real big believer in reducing the tightness with trigger point tools, deep tissue massage tools, and then also with physical therapy. Okay, I just think people get better. I think it's really, well, I'll tell you another story. I was hearing this dermatologist. He was doing a lecture, and he said, there's something that they treat called psoriasis. Okay. Psoriasis is a skin condition that some people have. And it's been totally proven that if you use a topical steroid consistently on your skin, like your psoriasis will go away. There's no way it can't go away. And this doctor, when he was doing the lecture, he said, The best way to get people to use topical steroids, you guys, what do you guys think it is? What's the best way to get someone to use something, let's say every day or twice or 3 times a day? Do you have any idea what's the best way as a doctor to do that? I guess you can maybe use an app. You can call the patient every day. And I'm going to use this, the example I'm going to use it as is like doing foam rolling or loosening or stretching or things like that. No one answers the best way. The best way is to see the patient every other day in the office. Okay. The best way is to see the patient every other day, because patients always do what you tell them right when they leave and right before they come back. Right when they leave and right when they come back, because it's fresh in their mind. But a lot of times for us, we don't see you, for 4, 6, 8 weeks. And that's, in my opinion, part of it. I think the physical therapy, they do things. They do Graston technique. They evaluate everything, your hip, because a lot of times it's due to your hip. But I also think having that consistent treatment 2 to 3 times a week, and you're having someone always checking to make sure you're doing your homework. Okay. And it's like our kids when they do Kumon. We have them do Kumon at home. I don't know if your kids have ever done Kumon, but it's basically you're paying Kumon to make you do homework with your kids every day. That's what it is. You're paying them money so you'll do homework with your kids. But it's the same thing. You need to do this, the foam rolling, otherwise it won't get better. But I think that's a big key, okay, is reducing the tightness. So the last point I want to talk about before I get into the questions is how do we treat it successfully? Well, I put here, proper diagnosis is key. Many people think they have heel pain, and they may have something else called like a bursitis. They might have a fibroma, which is they might have a mass, they might have a cyst, they might have something else. So you need to get it checked out by a professional. Okay, so you need a proper diagnosis. I find you need to have a shoe evaluation and bring your shoes in. It's very common for patients to bring in whole sacks of shoes, and we show them which ones are good, which ones aren't. Sometimes orthotics, but really I think the things that's really changed in the last 15 years for me are what I call the high-tech treatments. And the 2 things that I use most common is an ultrasound. This is a diagnostic ultrasound. This is a very, very bad view. But basically what you're looking at, there's more black right here, and there's less black right here. So with ultrasound, we can look at black, which is swelling. And other thing you can do is black is swelling. You can also measure the thickness. So a lot of times with plantar fasciitis, the plantar fascia is a lot thicker. And then this here is an example of one of the shockwave machines. We have 2 of them. This one, the way it works is you have a little bullet, goes back and forth, makes these shock waves, and it hits the fascia and it helps it to heal. Okay, that's kind of how it works. I think I talked about this for all of you. So we're coming kind of down here to the questions. I want to explain. I keep changing the way I'm treating people. I find this is a much more effective than it is this. I used to use this one. This is like a checklist. It has the same thing, but it's just a little bit too busy. So I'm just kind of giving you a rendition. If you watch this interview, this webinar in the future, I'll keep changing it. I'm going to go over some quick questions here, but before I get into those, I want to make a really good point. We have 4 doctors here. Okay, we all have different styles. So you may have been treated with cortisone by one, shockwave by another, orthotics with another. We all treat different. It's not that one is good or bad or better. Okay. I only do shockwave if your pain is like less than 8. If your pain is 8, 9, or 10, or you're limping, you're going to get a cortisone from me, except if it's in the Achilles. Okay. So it really depends on when the pain level. So that's a doctor decision. But we all have different styles, but don't just go for the quick fix. I think a lot of patients in the past, or even today, they come in, they say, hey doc, just give me the shot and I don't want to come back ever. Whereas a lot of times there's other things going on that you have to evaluate, because many times patients get a shot and then it'll come back. Okay. So you need to get the right treatment, can really speed up your improvement and help it from coming back. How do you find a heel pain? If your guys aren't from Massachusetts, or, you can see someone else, the main thing I would do is find someone that has state-of-the-art treatments. You want to ask whoever you're seeing if they have ultrasound and if they have shockwave. That just means they have the most state-of-the-art treatment. That's my opinion. Okay. And then at the end, I'm going to go over some of these booklets. Okay, so let's go over some of the questions, and then I can answer. If you guys want to start typing any questions you have, I'm going to answer those. Okay, so let's go here. Question number 1, why is heel pain in both feet and worse at night? Okay, I would say maybe 1% of patients have it in both feet. It's very, very rare. Thankfully, it's not in both feet. Okay. Most people, why is it in both feet? Well, probably because I don't know, your calf is tight in both feet. Why is it worse at night? I think so that most people have it worse in the morning when they get up because things are tight, and it's worse at night because you've been on your foot all day. That's why I think it's worse at night. Why do I feel pain in the morning too? Once again, I talked about that. It's because things are tight. How long does it take for plantar fasciitis from running to resolve, even with EPAT, assuming training continues? Now, one of the benefits about EPAT, or it's also called shockwave, is that you can continue training. There's no downside, unlike a cortisone and things like that. You can continue training. So the EPAT, let me explain. We do 3 to 6 sessions. Okay, someone asked me, is it covered? You can use your flex spending, but it's not covered. Okay, it's not covered by insurance. But like I have patients that have had this for 6 months or a year or 2 or 3, and they've tried cortisone, they tried everything, and this is what works for them. So it's really how much time do you have to spend on this? You can do it. Now, the final results take 4 months. You usually start to see improvement after 6 weeks. Okay. It's not instantaneous. Some people, it has better improvement, but I think the quicker improvement that people have is mostly from loosening up the calf. I officiate soccer in the fall. Back over my chronic Achilles tendonitis has me in pain. Once again, chronic Achilles, probably some thickening going on there. Shockwave would be probably the best thing. You're on it more, so possibly one of these braces to offload some of the pressure going through the Achilles, but it's all that stress and strain going through it. I'm not sure if this is me, but I have significant pain and stiffness in my heel, ankle after sitting 30 minutes. Once again, sitting in the car, getting up from sitting down, that's normal because of the tightness. I can stand all day, no visible swelling in the morning stiffness. That's typical plantar fasciitis or Achilles tendonitis. Is minimal, but I do take muscle relaxers. Okay. So those were the questions I had. Do you do both sides at the same time with shockwave? You know, I do. I have a couple of patients. Normally it's not for plantar fasciitis. Normally it's for Achilles tendonitis. It seems like I have more both-sided Achilles tendon or bump in the back called a Haglund's. It's more common in Achilles than it is, or bone spur in the back of the heel. Now, one thing that people always ask me, doctor, is this caused by a bone spur? No. Maybe the Achilles one if there's a chip, but very rarely it's the spur. The spur isn't the problem. Why was going barefoot recommended by your office rather than wearing my custom orthotics? Okay, once again, as I said, there's different types of treatments. I think, okay, we'll go over that in a second. So there's different types of treatments. Let me explain. There is a natural way of treating heel pain. Okay, the natural way, it could be using something called correct toes, which are these toe spacers, a minimalist shoe, which is a shoe that has a wide front foot, and walking barefoot. The purpose of this is to strengthen the intrinsic muscles of your foot. Okay, I don't have all the time to talk about this, but once again, for certain patients, okay, you want to strengthen the intrinsic muscles by going barefoot. So once again, if your heel pain hasn't been there for a long, long time, if on the ultrasound, it's not super duper thick, you know, things like that. If you're a younger person that's active, you can try to strengthen your plantar fascia while you're treating the Achilles tendon, like young runners, young active people, younger people. That's just the way I kind of put it together. So I think custom orthotics are beneficial, okay, for a lot of our patients. They're not covered by insurance. Some insurances, they do cover them. But once again, if you kind of think about it, orthotics can sometimes weaken the foot, okay? It can kind of weaken the foot. That's the philosophy. There's 2 philosophies. There is the orthotic stability, and there's the barefoot. Now I'm kind of in the medium, in the middle, mid range. Now let me explain what I do. I think cortisone injection, shockwave, orthotics are good while things are acutely inflamed and painful. Once you feel better, I like to get you back going barefoot. But what I find is that during the recovery period, if your heel really hurts, it's going to be hard for you to even walk barefoot, whereas an orthotic can take some pressure off it. So that's kind of the way I think about it. And those were the only questions I had here. No one else put any questions in there. Okay. Does this condition typically occur all of a sudden? Yes. No one really, very rarely do people injure their foot. It's caused by overuse. Happens all of a sudden, all the time. Okay. So those were great questions. Okay. I'm happy to answer other questions. You can email me. You'll be getting an email. Just reply to that email. Now, in that email, you're going to get the bonus if you stuck around. So there's a couple ways of doing this. You can download the individual books. I'll send you links to the plantar fasciitis book, Achilles tendinitis book. There's a great shoe buying guide where I tell you about all my favorite shoe places. My favorite one these days is Marathon Sports, Sneakerama. Okay, Marathon Sports, Sneakerama. And there's one here right next to our PR Running, right next to our office here in Westboro. So those are the 3 running shoes. But if you don't want a running shoe, okay, you can go to Evans in the Common. They're in Townsend. That's my best shoe buying place. They are great. Okay, if you say I sent you there, they'll give you 10% off. I'm going to send you a link to my welcome packet where I have tons of stuff in here about all. I can see my magic trick. I put a magic trick in my welcome packet. So if you want to watch that, I also include all of my other links to the books, my courses, all this stuff. And I have a lot of stuff as well on my other passions are like healthy living topics, intermittent fasting, bulletproof coffee, all these other kind of crazy things that I do. My plantar fasciitis course as well. And then, but I put it all inside of this foot treatment toolkit as well. If you want this is something that I'm trying as well. It's kind of a toolkit, has everything you need just in case. Okay. So there's a question here about Tom Codd's work on strengthening peroneals. I don't have a specific, I'd have to ask some of my buddies. I don't have a specific, maybe you can send me that, Alan, reply to my email. I'd love to look at strengthening the peroneals. I think strengthening all of the posterior calf muscles, I think is key. I think peroneals, yes. So it sounds like it's coming from a physical therapist. So thank you. This is that kit. Okay, so I'm going to stop my sharing, and I hope that was beneficial. You can all see here. Hope we didn't overwhelm everyone. We got about 17 people here. Thank you all for coming. If there's any other questions, you guys can stick around. I can stick around for about 5 minutes. But thank you so much. Hope you enjoyed. If you need help, just reply to one of the emails. Happy to see you in the office. Okay, thank you.